Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear a doctor, Emily Thompson, giving a detailed presentation on hypothyroidism. You now have 90 seconds to read questions.
Hello, my name's Dr. Emily Thompson. I'm an endocrinologist, and today I'm going to talk about a condition called hypothyroidism, a common disorder that affects the thyroid gland. The thyroid is a small, butterfly-shaped gland located at the base of your neck, and it plays a crucial role in regulating your metabolism. Hypothyroidism occurs when the thyroid doesn't produce enough thyroid hormone, which can lead to a range of symptoms that may develop slowly over time. Many people with hypothyroidism are unaware that they have the condition because the symptoms can be subtle and are often attributed to other causes. The most common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, leading to decreased hormone production. Other causes include surgical removal of the thyroid, radiation therapy for cancer, and certain medications. Hypothyroidism is more common in women, especially those over the age of 60, and it tends to run in families. It's also associated with other autoimmune diseases, such as type 1 diabetes and rheumatoid arthritis. Symptoms of hypothyroidism can vary widely, but some of the most common include fatigue, weight gain, cold intolerance, and dry skin. Many patients also experience constipation, depression, and memory problems. In more severe cases, hypothyroidism can lead to a condition called myxedema, which is a medical emergency characterized by extreme fatigue, low body temperature, and swelling. However, with proper treatment, these symptoms can be managed effectively. Let me share a case I encountered recently. A 45-year-old woman named Karen came to see me complaining of fatigue, weight gain, and feeling unusually cold all the time. She had been experiencing these symptoms for about a year but had attributed them to getting older and the stress of her job. However, when I examined her and reviewed her medical history, I suspected hypothyroidism. We performed a blood test to measure her levels of thyroid-stimulating hormone, TSH, and free thyroxine, T4, and the results confirmed that she had hypothyroidism. Karen's case is a good example of how hypothyroidism can be mistaken for other conditions or simply attributed to lifestyle factors. Fatigue, for instance, is a common symptom of many different health issues, but in Karen's case, it was a key indicator of an underactive thyroid. Once we had the diagnosis, we could start her on the appropriate treatment, which involved daily hormone replacement therapy with levothyroxine. This synthetic hormone is identical to the T4 that the thyroid normally produces, and it helps to restore normal hormone levels. When treating hypothyroidism, it's important to tailor the treatment to each individual's needs. For most patients, the goal is to normalize TSH levels with the lowest effective dose of medication. This often requires periodic blood tests and adjustments to the dosage, especially in the first few months of treatment. Patients also need to be aware that it may take several weeks to start feeling better after beginning treatment, as the body needs time to adjust to the increased hormone levels. In addition to medication, there are lifestyle changes that can help manage hypothyroidism. A healthy diet is important, particularly one that includes sufficient iodine, which is essential for thyroid function. However, it's also important not to consume too much iodine, as this can actually worsen hypothyroidism or even trigger hypothyroidism. Regular exercise can help manage weight and improve energy levels, which are often affected by hypothyroidism. Stress management is also crucial, as stress can exacerbate symptoms. Another case I'd like to mention is a 38-year-old man named James, who was referred to me after his primary care physician noticed an enlarged thyroid, also known as a goiter, during a routine physical exam. James hadn't noticed any symptoms other than some mild fatigue, which he attributed to his busy lifestyle. However, his blood tests showed elevated TSH levels and low T4 levels, confirming a diagnosis of hypothyroidism. In James' case, the presence of a goiter was an important physical sign that led to further investigation. Goiters can occur in both hypothyroidism and hyperthyroidism, but in James' case, it was due to the thyroid gland working harder to produce hormones, which is typical in hypothyroidism. Treatment for James involved hormone replacement therapy, and after several months of adjusting his dosage, his thyroid levels normalized, and the goiter gradually reduced in size. When managing hypothyroidism, it's also important to consider the potential long-term effects of the condition. If left untreated, hypothyroidism can lead to an increased risk of cardiovascular disease, particularly because it can cause high cholesterol levels. Women with untreated hypothyroidism who become pregnant are also at risk of complications, such as preeclampsia, anemia, and even miscarriage. Therefore, early diagnosis and consistent treatment are key to preventing these complications. One of the challenges in treating hypothyroidism is ensuring patient compliance with the treatment regimen. Because the symptoms of hypothyroidism can be vague and develop slowly, patients might not realize the importance of taking their medication consistently. In addition, some patients may become discouraged if they don't see immediate improvements in their symptoms. That's why it's crucial for healthcare providers to educate patients about the nature of the condition and the importance of ongoing treatment. In summary, hypothyroidism is a common but often overlooked condition that can have a significant impact on a person's quality of life. However, with proper diagnosis and treatment, most patients can manage their symptoms effectively and lead a normal, healthy life. Regular monitoring and a personalized treatment approach are essential to ensuring the best outcomes for patients with hypothyroidism.
Extract 2. Questions 37 to 42. You hear an interview of Dr. Eleanor Hayes discussing AI in primary healthcare. Now, read the questions. You now have 90 seconds to read questions.
As AI technology advances, its role in primary healthcare is becoming increasingly significant. There's a strong belief that AI could revolutionize how healthcare is delivered, potentially improving both efficiency and patient outcomes. I'm Greg Palmer, and today my guest is Dr. Eleanor Hayes, co-author of a recent article exploring the potential of AI in primary care. Dr. Hayes, what do you think the future holds for AI in primary healthcare settings?
Well, Greg, I think we're looking at a transformative period in healthcare. AI has the potential to handle a range of tasks, from diagnosing common ailments to optimizing treatment plans based on vast amounts of patient data. What we'll likely see is a gradual integration of AI into existing healthcare systems, with AI assisting healthcare professionals in making more informed decisions. This transition will require healthcare providers to adapt to new technologies while maintaining the human element in care, which is critical for patient trust and satisfaction.
That's fascinating. Could you elaborate on how AI might change the day-to-day operations of primary healthcare providers?
Certainly. One of the primary areas where AI will have an impact is in streamlining administrative tasks. For example, AI can automate appointment scheduling, manage patient records, and even handle billing processes. This could free up time for healthcare professionals to focus more on patient care rather than administrative duties. Moreover, AI-powered diagnostic tools can assist in identifying symptoms more quickly and accurately, allowing for earlier interventions and potentially better outcomes for patients.
It sounds like AI could significantly enhance efficiency, but how do you see the integration of AI affecting the patient experience?
That's a great question. The integration of AI in healthcare could greatly improve the patient experience, especially in terms of accessibility and personalization. AI can analyze a patient's medical history and preferences to tailor care plans specifically for them. For instance, AI could suggest lifestyle changes or medication adjustments based on real-time data. However, it's crucial to ensure that the implementation of AI doesn't compromise the personal touch that patients value. The challenge will be in balancing AI's capabilities with the need for empathetic, human-centered care.
AI is often seen as a tool for enhancing healthcare, but are there any concerns or limitations that you think need to be addressed?
Absolutely. While AI offers many advantages, there are also significant challenges that need to be considered. One major concern is data privacy and security. With AI systems relying heavily on patient data, ensuring that this information is protected from breaches is paramount. Additionally, there's the issue of bias in AI algorithms. If the data used to train these systems isn't diverse enough, there's a risk that the AI could make biased decisions that don't fairly represent all patient groups. Lastly, there's the need for healthcare professionals to be adequately trained in using these tools. Without proper training, the benefits of AI could be undermined.
Those are important points. In your article, you mentioned that AI could also play a role in preventive care. Could you explain how that might work?
Certainly. AI has the potential to shift healthcare from a reactive model to a more proactive one. By analyzing patterns in patient data, AI can predict potential health issues before they become serious, allowing for early intervention. For example, AI can identify risk factors for chronic diseases like diabetes or heart disease and recommend preventive measures. This could include lifestyle changes, regular screenings, or even early treatment options. The ability to predict and prevent health issues could be one of the most significant contributions of AI to healthcare, potentially reducing the overall burden on the healthcare system.
Finally, what advice would you give to healthcare organizations looking to adopt AI technology?
My advice would be to start small and focus on areas where AI can have the most immediate impact. Begin with pilot projects in specific departments or tasks, such as automating administrative functions or using AI for diagnostic support. It's also important to involve healthcare professionals in the implementation process, ensuring they are comfortable with the new technology and understand how it can enhance their work. Additionally, organizations should prioritize data security and ethical considerations, making sure that any AI solutions adopted are transparent and fair. By taking a measured approach, healthcare organizations can gradually integrate AI in a way that enhances care without overwhelming the system or staff.